So, all right, this is the final exam review for pathophysiology. There will be, it runs from, let me tell you the dates. It's the opposite of your health assessment final. So it runs the 14th. I should have had this better marked down. It runs the 14th at 6 a.m. until the 17th at 23:59. There will be a total of 100 questions, and there's a 2-hour time limit. 40 of the questions will come from the last 3 chapters that we covered, 10, 13, and 14, which is what we'll go over tonight. And then 60 of the questions will come from the other chapters 1 through 11. The thing that I always tell students to do is that go through your other study guides that you made for the first 3 tests and review those, because the questions are taken from all that from those informations from the other study guides. So that should help you, just review the information for the other chapters. You do have to use Respondus Lockdown as well. And before grades are finalized, I will review them just so, for any inconsistencies in grades or difficult questions that the whole class had a hard time with. Remember, I know there's a bunch of you taking your HESI test later this week. If you get 850 or over, you will be blessed with a 95 and can opt out of the final exam. So once we have all those final, once you have your final score, you can email me, but I think the last person is testing on Saturday night. So we will get the list then on Monday morning. So we will start with chapter 13, the integument system. The basic anatomy and physiology, just kind of the parts of the system and how it works. There is a description of the lesions on page 631, table 13.1. There are always questions about the different kind of lesions, and you will forever need to know that. I still have to review it sometimes when I'm trying to describe a lesion, but especially in primary care, you'll be looking at lesions a lot. You also need to know the basics of pigmented birthmarks, and there's a page or 2 on integument changes with age. As far as dermatitis, you just need to be able to tell the basic difference between how and what contact dermatitis is, what allergic dermatitis is versus atopic dermatitis. Just be able to kind of distinguish between the 3. And if you're looking at something, what are the characteristics of those 3 things that kind of make you lean towards one diagnosis or the other? There's one question on urticaria. And the one thing I wanted you to remember and to kind of highlight is just that in many times, we do not know why someone has urticaria. Sometimes it's very obvious, you can point it out, but there are times that people come into the hospital with urticaria and they stay for a couple days to treat them with the steroids, but we have no idea actually what caused the problem. Be able to define and know the basics of what psoriasis, folliculitis, and impetigo are, and cellulitis. Folliculitis, impetigo, and cellulitis are treated with antibiotics, but just know what they're a little bit different. Folliculitis is around a hair cell. Impetigo is a localized skin infection, usually on the face, and cellulitis is a redness that you can see that is in a leg, an arm, or something associated with some kind of incision or wound or something like that. Hopefully you've all seen cellulitis in your practice that you can identify that. Just need to be able to tell the difference as well between herpes simplex 1 and herpes zoster. What are the different presentations and the different locations that they have? Tinea and scabies, just be able to tell what they are and the differences. On burns, on page 551, at the very bottom on the right-hand side, there are terms that relate to the severity of the burns, like partial thickness. Just be able to distinguish those, because There will be a question on the test, but that's one of those questions that are always on a they're always on a certification test as well. The clinical manifestations, want to know the basics of them, how a diagnosis is made, and basic treatment. And remember, your clinical manifestations and your diagnosis are probably going to come from your history and physical, and who the patient that you're treating is going to give you the background story to tell you how those burns got there. And the most basic of treatments is to remove the stimulus, or remove the thing that has done the burn. Want to have a general idea of what acne is and be able to distinguish between basal cell, squamous cell, and melanoma skin cancers. What are the different, how do they look? What are the different signs and symptoms of each one? Any questions on the integument system? No. Okay. As far as sensory function, you want to have a general idea of the general sensory pathway, and that's on the very first page of the chapter. I'm sorry, I forgot to write the page number down. Have a general idea of pain mechanisms and the gate control pain theory. You want to have a basic understanding of the anatomy of physiology of the eyes and the ears, like what helps us, how do we see and how do we hear? How does that happen? You want to know any changes that are associated with age. As far as the eye goes, you want to be able to talk about what conjunctivitis is. And blepharitis, just know the basic pathophysiology of that and how how does it happen? I will kill that word if I say it, hordeolium, but it's basically a sty on the eye. So you want to know what that is. What is the bacteria associated with that most generally? That's Staph aureus. And generally you can treat that with warm compresses. You want to be able to distinguish between otitis media and external omedia. Otitis externa. Sorry, it's been a long day. I just put my kids to bed. Corneal, just know what a corneal abrasion is and what a foreign body, like what will that feel like to the patient. And there are several different kinds of glaucoma, open angle versus closed angle versus acute closed angle. You want to know the signs and symptoms of each and what are the basic treatments. And just review what cataracts is, otosclerosis, retinal detachment, tinnitus, and vertigo. Again, very basic pathophysiology and signs and symptoms. Any questions about that? Okay. Last but not least, as far as the new information goes, is the endocrine system in chapter 10. There is a lot of pathophysiology here, so I tried to focus in a little bit on what are the most important things that you need to know. The endocrine system release of the hormones is on page 449. And there's a great picture of how the pituitary gland functions on page 451 to kind of help you put it all together. On page 452, there is a nice chart that talks about the endocrine hormones. And again, try to think when you're looking at them, just try to think about what you already know and what you've seen and put that together with the new information. You wanted to be able to distinguish between hyperpituitarism and hypopituitarism. Specifically about prolactinemia, just know what the causes are. You want to be able to distinguish between SAIDH and diabetes insipidus. So in diabetes insipidus, sodium levels are actually elevated because the patient is urinating so much, the blood becomes so concentrated that sodium levels actually are elevated. It's kind of opposite of what you would think. And then in SAIDH, there is a retaining of fluid volume. So those folks often have hyponatremia because they have excess fluid volume in their blood. So that dilutes down the sodium. So that's the main way to explain it, but it's on page 462 as well. Diabetes is obviously a big part of the chapter, so you need to be able to compare and contrast type 1 and type 2. There are a bunch of metabolic disorders associated with diabetes, and that is on page 466, figure 1010. Know what metabolic syndrome is, what are the definitions? Obesity, there is, again, just some general understanding of the pathophysiology is what you'll need to know. Treatment recommendations can vary, but the pathophysiology is what the question will focus on. Be able to discuss what goiter is. And when you talk about hypothyroid versus hyperthyroid, those are manifested in the clinical manifestations that each disease has, and those are listed in a very nice chart on page 475 that kind of help you distinguish between the two. There's one question on distinguishing whether a disease is hypoparathyroid or hyperparathyroid. So again, that kind of goes down to the clinical manifestations. You know, want to know what pheochromocytoma is and what are some of the issues related to that pheochromocytoma can cause. And then again, you want to be able to understand the basics between Cushing's disease versus Addison's disease, just a general pathophysiology difference and the signs and symptoms. Remember that you have your Navigate 2 resources as well to help you study. There you can get the chapters read to you. They have lectures there. They have the flashcards that can help you study. And I am almost done with the lectures for these as well, and they'll be posted by Friday at the latest. So, does anybody have any questions? All right, I'm just going to stop recording and stop the screen share.